Hi guys, do you know the first few minutes after an accident or an emergency can make the difference between life and death? Let's check out what we can do in case of an emergency. Step 1, remain calm. You are calmness personified, and that would in turn help everyone in front of you. Step 2, call for help for any person who's collapsed in front of you. After calling for help, for which you can use a smartphone or shout out for help, you then look after the patient's response with a pulse and a breathing check together. You check for pulse for at least 10 seconds, never more than 10 seconds, and then you check for breathing. If the person's not breathing or you don't have a pulse, you start CPR. CPR starts with you placing your heel of your palm over the lower half of the patient's chest and then overarching the other hand over it and then compressing the patient's chest to ensure that there is some blood that is supplied to the brain. Ensure that when you're doing CPR, you are close enough to the person to give a breath at the end of 30 compressions. Now remember, for how long would you do it? Until help arrives. This is the worst case scenario that you can face. The second worst case scenario that you can face is a person who's choking in front of you. What do you do when somebody chokes in front of you? Somebody who's choking in front of you would have the universal choking sign. They'd be leaning forward, trying to gasp for breath. You need to come from behind, ensure that you're curling around the patient's chest and abdomen. Over the lower chest and upper abdomen, you give backward and upward thrusts so that they can expel it out. More importantly, ensure that the patient's comfortable before you start off doing the procedure. What do you do when you have a cut injury and you've got excessive bleeding? That is where a first aid kit comes in. In a first aid kit, you need to have cotton, you need to have gauze, and you've got to have bandage in addition to an antiseptic solution and a plaster. The moment bleeding starts, you just need to apply compression with the gauze bandage or a cotton wisp and a roll around it. Ensure that the hand, if it's a cut injury, is placed above your level of the heart so that the blood circulation does not increase the amount of bleed from that portion. If you've got somebody who's having a seizure in front of you or fits in front of you, make sure you get them down on a left lateral position so that they're lying on the left side with thighs onto that side, and then ensure that the airway is open or the mouth is kept open on that side. There is no point giving them any metal keys, anything metallic onto their hands, or forcing anything onto their mouths to open their mouths. Doesn't sound too complicated, right? A little knowledge, a lot of courage, and you might just save a life. This First Aid Day, World First Aid Day, let's pledge to carry a kit. Let's pledge to save more lives. Let's pledge to help these people who are in distress. Because emergencies don't wait, and neither do heroes. This is Dr. Vimal signing off. Thank you for listening.